Hello everyone. Today you will be watching our formal debate on the ethics of treatment approaches for applied behavioral analysis. Applied behavioral analysis has a long history of developing evidence-based treatments that positively improve the maladaptive behaviors associated with individuals with autism. Despite this long history of evidence-based treatment, ABA continues to be considered unethical by some individuals with disabilities, advocates, and professionals. My name is Brittany DeStefano, and I will be the moderator. During this debate, we will examine both sides of this issue and present statements that consider arguments for and against applied behavioral analysis in the following areas: the fairness of everyday protocols, procedures, and practices, real-life experiences and attributions of people, present multiple perspectives on all of the issues, impact of legal and ethical violations, comparisons of evidence-based measures and treatments, interventions, positions on why ABA is or isn't ethical. Before we start, I would like to set the rules for this debate. Each person will be allotted 30 seconds to 2 minutes to discuss their points. At no point is anyone allowed to attempt or talk over another presenter. Now, I would like to introduce the other members of this debate. On the pro side, we have Misty Majeski as the stater and pro attacker.
Hello.
Continue on the pro side, we have Kristen Zager as the prover.
Hi.
On the con side of the ethical treatment of ABA, we have Randy Ames as the stater and attacker.
Hello.
And continuing on the con side, we have Terry as the prover.
Hey.
Misty will be our first presenter with the pro side stater. Misty?
ABA uses everyday protocols, practices, and procedures to apply fair treatment. ABA is the use of natural science to discover variables that reliably influence socially significant behaviors and develops technology to take practical advantage of the discoveries. ABA uses a rigorously enforced code of professional ethics that allows us the best hope for solving many problems. This strict ethic code ensures clients the right to effective treatments that are based on scientific knowledge, as well as the right to treatment that is socially significant and acceptable to the client. Beowulf and Risley, 1968, defined applied behavior analysis application as a self-examining, self-evaluating, discovery-oriented research procedure for studying behavior. In the 1969 article, 7 Dimensions of Applied Behavior, Beowulf and Risley describe practices that ensure and fairness of everyday protocols, practices, and procedures of ABA.
The immersive training components of ABA therapy that are part of the history of everyday practices of ABA under the Lovaas model, while effective, hardly speak to the fairness of the science. Punishing children for maladaptive behaviors such as hand flapping and vocal outbursts is certainly not fair to the child. Another problem with ABA is placing the focus on changing behaviors to make a child with autism appear non-autistic. From the viewpoint of the child, not being allowed to engage in a behavior that is enjoyable and or comforting in order to fit in with peers certainly seems unfair. From the autism ABA viewpoint, autistic behaviors are to be rejected and replaced with those indistinguishable from their peers. The final reason why the everyday practices, protocols, and procedures of ABA may be viewed in an unfair manner is due to the issue of consent. Behavior analysts take parental consent as sufficient to enroll a child with autism into a program designed to transform the behaviors of the child. Little is known about the acceptability of the components of ABA practice upon the child receiving services. The definite lack of inclusion of the recipient into behavior change in the social validation process is of huge concern.
As mentioned by Misty, the 7 dimensions of ABA are used to help ensure proper procedures, protocol, and practices in the field of ABA. The 7 dimensions of ABA include applied, behavioral, analytical, technological, conceptually systematic, effectiveness, and generality. All of these dimensions focus on things such as changing behaviors that are socially significant, accurate and precise measurement of the behaviors, experimental control over occurrences and non-occurrences of behavior. Interventions in place are based on basic principles of behavior and producing behavior change that lasts over time and appears in other environments. The BACB has a professional and ethical compliance code that behavior analysts must follow. One of the codes pertains to treatment intervention efficacy that states in section 2.09 that clients have a right to effective treatment, which is based on the research literature and adapted to the individual client. Behavior analysts always have an obligation to advocate for and educate the client about scientifically supported, most effective treatment procedures. Effective treatment procedures have been validated as having both long-term and short-term benefits to clients and society. Another reason that ABA is an ethical and effective treatment is because it uses internal, external, and social validity, which acts as a guide to the fairness of everyday protocols, procedures, and practices. Experiments that show convincing changes that are a function of the independent variable or the intervention and not the result of an uncontrolled or unknown variable have internal validity. Our procedures are scientifically and functionally based in order to affect change in behavior. Furthermore, this follows the BACB Ethical Compliance Code, which follows section 1.01, reliance on scientific knowledge. Behavior analysts rely on professionally derived knowledge based on science and behavior analysts when making scientific or professional judgments in human service provision or when engaging in scholarly or professional endeavors. External validity refers to the degree a study's results are generalizable to other subjects, settings, and/or behaviors. We want to affect behavior change that will transfer from the learning environment to the client's entire environment. We teach specific skills in order to build a larger set of skills that can be applied throughout settings, environments, and types of interactions in the client's life. Replication and generalization are the standard of ABA procedures and practices. According to Wolf 1978, professionals in ABA should judge the social significance of the target behavior, the appropriateness of the procedures, and the social importance of the outcomes. This is called social validity. This can be found in the BACB Ethical Compliance Code section 3.03, Behavior Analytical Assessment Consent, which states, prior to conducting an assessment, behavior analysts must explain to the client the procedures to be used, who will participate, and how the resulting information will be used. Second, behavior analysts must obtain the client's written approval of the assessment procedures before implementing them.
Terry, go ahead.
A major criticism of ABA practices is the use of aversive therapy, including pain such as electric shock, to deter behaviors such as self-injury. In the 1987 Lovaas research study, high rates of aggressive or self-stimulatory behavior were reduced by being ignored, by the use of timeout, by shaping more socially accepted behavior, and as a last resort, the delivery of a loud no or a slap on the thigh, contingent on the presence of the undesirable behavior. A 2008 survey of leaders and scholars in the field of positive behavior interventions report that more than 1/4 regard electric shock as sometimes acceptable, and more than 1/3 would consider using sensory punishment, the use of bad smells and loud noises, or foul-tasting substances, according to the Davida Rayburn 2016. Another problem with ABA is practicing the focus on changing behaviors to make a child with autism appear non-autistic. ABA is a powerful intervention that can teach autistic children valuable skills. However, it seems unnecessary to remove odd behaviors such as rocking and flapping with social behavior and replace them with social behaviors such as pointing, joint attention, and appropriate gaze that may be stressful, painful, or useless to the child. According to Dawson 2004. Reed, a young man with autism who received ABA therapy between the ages of 2 to 5, states that he worries ABA forces children with autism to hide their true nature to fit in. It's taken me a long time to not be ashamed of being autistic, and that only came because I got the chance to learn from other autistic people and be proud of who I am. Also from the DeVito Rayburn 2016 article. Everyday practices of ABA are viewed as unfair because of the lack of inclusion of the recipient of the behavior change in the social validation process. This is a huge concern for Dr. Bauer and colleagues brought up when criticizing some of Dr. Lovas's previous work. Parental consent is not always sufficient to protect a child, and Dr. Bauer considered a process of ethical review necessarily to balance interests and mitigate harm. ABA services do not use an ethical review process to ensure a child is in agreement with the behavior change process. In the very least, questions such as which behavior should be treated should be asked rather than the ABA goal of moving all autistic behaviors to recover a child to make the individual the same as typical peers, according to a Dawson 2016 article.
ABA helps teach children with autism to interact with their environment and to gain independence. Teaching nonverbal children to ask for necessities such as food, rest, drink, or new toys because they are bored and helps to reduce problem behaviors. Why throw a tantrum, scream, cry, destroy property, or become aggressive when you have the means to communicate? We look at the functions of behaviors and provide an alternative that meets the same need but is far easier and more appropriate. We do not seek to change children just to make them normal or achieve recovery. Through powerful analytic and technological tools, behavior analysts use science to help children interact in meaningful ways. ABA gives them the means to access natural reinforcers in their environment. What is unfair in teaching a child to communicate in order to get their needs met?
Once the child is taught to communicate using ABA procedures, do behavior analysts stop to ask the child his or her thoughts on the procedures, prompts, and protocols used throughout his or her treatment? ABA seeks to normalize a child with autism to fit the standards of society without seeking validation from the child. Parents and stakeholders assess the social validity of the procedures, but does the child have any say over the preference of behaviors to change, or even which procedures are found most acceptable by the child in treatment? ABA therapists do preference assessments on which food, toys, and activities a child prefers. Why not access procedures?
Clients and their families have a right to effective treatment. It is fair clients receive proven interventions that increase socially significant behaviors and decrease problem behaviors in an analytical, technological, conceptually systematic way that generalizes outside treatment. ABA practitioners do not seek to remove all autistic behaviors, but rather help a child adapt and interact within their environment in order to access natural reinforcers. ABA practitioners use the dimensions of applied behavior analysis, the mistakes of our past, and our code of ethics to guide us to find the best possible solutions to the problems our clients seek to resolve.
ABA has a long history of abuses that have necessitated the development of a rigorous code of conduct. Despite the emphasis on ethics, ABA fails to see the value of the autistic child's way of thinking, feeling, and behaving. The goal of ABA is to normalize the autistic child. All of this is done without the consent of the child. This lack of concern on transforming a child using powerful behavior interventions without the consent of the individual is a modern-day ethical breach that speaks to the unfairness of everyday protocols, practices, and procedures of ABA.
According to Labas in 1987, his research suggested that children with ASD and other behavior difficulties, unless given the opportunity to receive services such as applied behavioral analysis, the child is more likely to continue showing signs of maladaptive behavior. Now, in order to better understand the importance of real-life experiences and attributions of ABA to our group members will be presenting both positive and negative real-life experiences. Go ahead, Misty.
The story of the Maurice family and Let Me Hear Your Voice. After discovering Lovas's 1987 research article, the Maurice family started an intensive home-based therapy program for their 2 children with autism, featuring behavior practices as described in Ivar Lovas's 1981 book, Teaching Developmentally Disabled Children, the Me book. After consistently applying home-based therapy for 30 to 4 hours a week, 4 to 6 hours a day, 5 to 7 days a week for 2 years, using teaching procedures described in Lovas's Me book, the Maurice family reported their children, like the 47% in the 1987 study, recovered. After following intensive early intervention, the Maurices reported their 2 children no longer demonstrated traits of autism.
In regards to the perspective of someone benefiting from ABA, a recent Facebook user posted, August 1st, 2016 was our diagnosis day. I remember thinking, okay, what now? Applied behavioral analysis therapy has been the best decision we've made on our autism journey. This is how Des has learned animals, animal noises, shapes, colors, numbers, letters, how to not bite himself when he stims, how to not shove Calvin when Cal messes up his lines, etc. Everything Desmond has ever learned has been through ABA. I am forever grateful for ABA and the miracles we've seen through its application. I'm grateful for our amazing therapeutic team who has brought so much into our home.
Dawson, 2004, discusses the ethical struggles of ABA and the belief that ABA is a human rights violation. His main points states that the issue with ABA is having practitioners decide how people with autism should behave, and the challenges Lovas research study of 1987. In order to better understand the drawbacks of real-life experiences and attributions of ABA, Terry will be giving us a couple of real-life examples.
A Reddit user expressed her experience with ABA. She writes, because of ABA, I feel like someone has walked in on me using the bathroom. If they see me stimming, and this is bad, I now rip out my own hair because they wouldn't let me flap my hands or rock in my seat. Because of ABA, I feel like my body is not my own. A therapist told me that if I didn't wear a bra, people would call me bee stings and saddlebags. I was 12. Because of ABA, I am a chronic yes man, and I feel like someone will reject me if I try to set boundaries. An ABA therapist instructed my parents to lock me in my room overnight after I was toilet trained. I would cry for hours to use the bathroom. She told my parents I was attention seeking. ABA made me feel like I wasn't allowed to love myself as I was, that I had to be someone else to survive. I now have massive mental health repercussions.
To better understand ABA and why it is not ethical, let's hear from multiple perspectives that have been involved in the field of ABA. Go ahead, Misty.
Parents, BCBAs, and children that receive ABA have long sang its praises for helping improve lives and decrease maladaptive behaviors. BCBAs in particular believe ABA is ethical because it is based on a science that uses data to make clinical-based decisions. Furthermore, parents believe ABA is ethical because it has improved the quality of life for their child.
While some families benefit from ABA therapy, others are not so lucky. Many parents of children with disabilities are vulnerable to following professional guidance and opinions. However, not every professional complies by the ethical code established by the BACB, and parents and the child may be receiving harmful or inadequate therapy.
An article published by Walsh 2011 discusses a parent's view and reasons why ABA was beneficial for their child. One reason this parent believes ABA is important is because it helped their child build independence through interventions taught in ABA. They are not as reliant on them because of the skills they learned in ABA therapy. A concern for this parent was that one day they will not be here to take care of their child, but with the skills taught during ABA, they are not as worried when that day comes. Another reason this parent is an advocate for ABA is because it uses data-based interventions and treatments. This relates back to the Ethical Compliance Code Section 1.01, reliance on scientific knowledge. Furthermore, ABA can involve parent training to teach them how to respond to their children's behaviors. Without these parent trainings, many parents can feel lost or confused on what to do with their child's behaviors. ABA provides parents with hope and gives them the tools to live life with their child and not just survive.
Present perspective from former clients of ABA therapy from Davida Rayburn, from the Davida Rayburn 2016 article. The former client believes ABA was used to normalize him and to get rid of repetitive behaviors. He felt ashamed for having these behaviors, was never told of his diagnosis, and mainstreamed into school. This made him feel alone and felt like he had to hide his true self in order to fit in. ABA therapy can sometimes be presented as more of just getting rid of the target behaviors instead of trying to figure out why the child is doing them in the first place. The lack of seeming acceptance towards the world of neurodiversity has prompted advocates against ABA to define it as more of a cruel premise rather than an effective therapy intervention. A contributor to this article, the president of the Autism Self-Advocacy Network, Ari Neman, adds that as many parents feel after they have received an ABA diagnosis, that it was so strongly advocated for, they feel their child may have lost hope if they should choose to go a different route other than ABA.
ABA uses an ethical compliance code that states in Section 2.09 that clients have a right to an effective and research-based treatment. It sounds like the client mentioned in the article by Davida Rayburn 2016 might not have had the best provider. However, in every occupational field, there is someone that does not abide ethically or does not follow procedures. That is why it's important for parents to do research and hear from multiple perspectives before choosing an ABA provider or agreeing to a treatment plan for their child. Furthermore, Section 4.02 of the BA-CB Compliance Code states that clients have the right to consent to their treatment. If it is possible, clients should have a say in their behavior change.
While ABA therapy may benefit some children, as mentioned in the Walsh 2011 article, ABA therapy is not for every child. Temple Grandin stated that in the article by White, she does not believe that ABA therapy is a great option for every child diagnosed with autism. She believes that higher functioning individuals with autism, also known as Asperger's syndrome from the DSM-4, would benefit from more exploring their talents and strengths in a university setting. She believes doing this would benefit them more to get a job in the future rather than engaging in ABA therapy.
ABA follows a strict ethical compliance code laid out by the BACB. In every profession, there will be people that are either happy with the treatment received or had received with a provider that did not follow protocols to the best of their ability. Overall, ABA is based on science that uses data to make informed decisions and is used to target socially significant behaviors.
ABA therapy is usually the go-to treatment for a child diagnosed with autism. However, this type of therapy may not benefit every child. It is important that providers and parents look out for the child's best interest and determine if ABA therapy is the best option for them. Finally, in therapy, the goal should be to provide the best quality of life for the child through the interventions, not to normalize the behavior.
Now we will dive into the further understanding of ABA and why it is or is not ethical, and discuss the impact of legal and ethical violations in the field of ABA.
ABA has the potential to make clients not only rigid and narrow thinking, but potentially make them resentful of the treatment they have been forced to receive. While the use of positive reinforcement for a child who provides the desired behavior, clients could become conditioned to think that if they do not achieve the standards set for them high enough to be considered good, they will not achieve their own personal goals. These people could become stressed over their efforts to become successful instead of actually focusing on simply moving forward in their own lives. On the issue of positive reinforcement, parents and teachers have often believed that some treatments are too intensive and even potentially aversive. The idea that that the therapy demands too much from clients who are not ready to display the desired behaviors, therefore pushing them too hard and providing them with negative feelings that involve going to therapy or school for 40 hours a week. Additionally, skills learned in ABA are often too difficult for children and clients to generalize to other environments. Clients may only learn and retain a few ways of responding to the environmental stimuli. For example, they may struggle to generalize at the store, in social situations, or when dealing with various disagreements among peers and or friends. Some also say that ABA tends to be hyper-focused on lessening the number of behaviors that a client emits. Some argue that ABA forces them to behave as much like their neurotypical peers as possible in an attempt to potentially hide their autism diagnosis. It ignores the feelings and the needs of the client's reasoning for emitting these behaviors. This has potential to tell our clients that they are not acceptable as they are and that they should somehow be fixed or normalized. Additionally, some clients find a release of stress when they engage in stimulatory behavior. Some in the field of ABA strive to prevent clients from stimming in an attempt to replace it with a more socially appropriate behavior. However, as mentioned, stimming is often a release for clients, which can reduce stress and is even sometimes a simple display of happiness or excited emotions.
Evidence-based practice, EPB, carries a lot of weight in the field of ABA because it is considered to support many of the techniques that are used to help the children and adults with autism, as well as other people who have other disorders and mental delays. It is based on objective research that uses experimental control in a controlled environment to affect behavior changes.
Due to the attention on results that highlight causal and functional relationships between the often maladaptive behaviors and environments, people may sometimes wonder if the evidence-based practice is a waste of time and or whether or not it is right, or if it meets the family's standard of values for their loved one with negative behaviors. People are also opposed to ABA due to the fact that clients are only taught how to respond one way and will only respond if the conditions are the same as they were in the learning environment.
According to Singer, Agron, and Spooner 2017, it is due to the causal and functional relationships that exist between maladaptive behaviors and environments that EBP focuses on defining function so that treatments performed previously in different settings with different clients are able to reduce behavior. EBP studies meet certain levels of stringent criteria and undergo extensive criticism, as well as many other items that tend to take several years to complete. Additionally, just as people who fall to a more neurotypical behavior line are not all the same, EBP is not intended to be a one-size-fits-all. In many cases, a BCBA may still need to adjust the treatment of a client. With that being said, the field of ABA goes back longer than many realize, and there is a possibility that research that one is seeking has already been conducted. Finally, EPP has initiated many legal battles over the years, as well as some legislation. In similar way, shape, and form that data backed by science and research has improved, but not perfected, the lives of those who live in a disproportionate world, such as via the civil rights movement, EBP has also initiated new paths forward for treatment programs that are based upon information more valuable than those conducted without extensive scientific support.
While ABA is believed to be the most effective form of treatment for its multidimensional possibilities for learning, such as the utilization of reinforcement, motivation, and behavior shaping, there are some circles that question its ability to turn out a child who has the ability to be free-thinking individuals. Many believe that ABA has the potential to produce children who are robotic or rote. With this reasoning, the children might be capable of only initiating or responding if the conditions are right and in particular ways, based upon what they have learned in ABA therapy.
According to the April 2016 article, 10 Myths of Applied Behavior Analysis, it is common for children with autism to already have hyper-focus on details, behave somewhat robotically based on their own interests, as well as be unsure whether or not an intended or unintended stimulus has a child's attention. Additionally, it is common that children with ASD have specific and even obsessive preferences for interactions that seem minute to others, such as environmental interactions with others, preferred items, tasks, the arrangement of items, as well as many others. The goal of ABA is to claim control over rigid behaviors by teaching multiple exemplars so the children can generalize information to a variety of settings and encounters with the natural environment. ABA can be turned robotic at the beginning of a learner's acquisition program because they are taught to respond with answers that are successful rather than broad while working on building responses to SDs and other skills.
When evaluating the efficacy of clinical treatments, cost effectiveness must also be taken into account. While it is argued that cognitive behavioral therapy actually teaches clients new skills and the importance of appropriate behaviors, ABA may only reduce some maladaptive behaviors and not overall provide a greater quality of life for an individual. For the lack of potential functional outcomes, people who are anti-ABA may question whether or not the pros of it are most functionally economic for the individual or whether they simply focus on a more socially appropriate outcome. The argument is that if a treatment that you are paying for does not appear to be working, why would one continue to use it despite the apparent evidence-based practice?
When our clients act in functionally appropriate ways, they are reinforced through improved responses by surrounding people in their everyday environments. The goal of ABA is to teach clients how to access natural reinforcers in the environment. This is accomplished through teaching individual skill sets that can be built together in a larger repertoire of functional and appropriate social behaviors, reducing problem behaviors and teaching equally functional, socially appropriate behaviors to gain greater access to the surrounding environment and people in that environment provides a greater quality of life for the individual.
ABA is an evidence-based practice that successfully teaches very specific skills that often fail to generalize to the larger environment outside of the very specific environment and learning conditions they are taught in. ABA tends to teach learners to respond in rote, robotic ways that do not improve social outcomes. While problem behaviors are reduced, is this enough to improve the quality of life of the individual that responds in very specific and robotic ways to the world around them?
The next point of our discussion is comparing evidence-based measures and treatment interventions in order to better understand ABA and why it is or is not ethical.
When individuals or their families receive an ASD diagnosis, they are often confused as where to turn next. With the litany of treatment options available and the desire to begin treatment right away, confusion can often occur, resulting in improper treatment with non-evidence-based methods, resulting in crucial loss of time and resources. ASD has one of the largest evidence bases for practice when it comes to ASD. According to a review of evidence-based practices by Wong et al. In 2015, 456 studies between the years of 1990 and 2011 provide the base of evidence that applied behavior analytic-driven treatments are not only among the most successful treatment modalities, but have the largest body of research supporting.
Many parents can relate to the 2016 Davita Rayburn article on spectrumnews.org, which states that the parents are led to believe if you do not work with an ABA provider, your child has no hope. While ABA has been held up as the gold standard, it is not the only effective treatment method available. Too often, parents and clients are herded into ABA with very little understanding of what the process looks like and what their other options are. According to the Professional and Ethical Compliance Code for Behavior Analysts 4.03a, behavior analysts must tailor behavior change programs to the unique behaviors, environmental variables, assessment results, and goals of the client. Simply placing all clients into ABA because it presently has the largest evidence base does a disservice to the clients who may benefit from alternative treatment modalities. While ABA has been held aloft as the most effective treatment method for helping individuals with ASD obtain their goals, Alternate treatment modalities must be presented to the stakeholders to create a truly well-rounded treatment package that is tailored to the individual needs of the client.
ABA is not limited to one treatment type and can be customized for learners based upon their particular needs. In Wong et al. 2015, 27 practices were reviewed which were behavior analytical in their concept. These treatment types range from pivotal response training, which allows a great amount of individual choice and autonomy in the environment of their choosing, to discrete trial training, or the classic table time ABA, which allows for the learner to receive deeply intensive learning through mass trialing. Of all the ABA evidence-based practice present in the article, the concept with the most empirical support comes from the behavior analytical concept of positive reinforcement. Other treatment modalities may co-opt this method, but are they truly implementing it in a way that is conceptually systematic and not creating additional maladaptive behaviors?
While ABA is not limited to a single treatment type, it leaves very little room for any potentially effective treatments to be used. Alternate treatment types are available with peer-reviewed research supporting these methodologies. These types of treatments are approved methods by the CDC for treating ASD. First, RDI. RDI is a parent-driven approach to teaching social skills that may not present themselves in table-based ABA or even in pivotal response treatment modalities. In a study conducted by Hobson, Tarver, and Hobson 2016, it was determined that based upon ADOS scales, severity of autism was correlated with lower quality of parent-child interaction. Second, exercise-based therapies. Exercise-based therapies in the environment of the individual's choosing have been found to increase social behaviors. Participating in an academic task as well as sensory integration skills. Third, sensory integration therapies. In a study conducted by Roberts, King, Thomas, and Baccia, individuals received an hour session of sensory integration therapy 3 times a week. It was found that the overall aggressive acts of the participants decreased significantly, suggesting that sensory integration therapies may be effective on their own without additional therapies.
While these alternative treatment methods may seem attractive on the surface, there is not as much solid evidence supporting them as first appears. In a literature review of sensory integration studies for individuals with ASD conducted by Lang et al. 2012, many of the reviewed studies, including the 3 studies reporting positive results, had serious methodological flaws. Therefore, the current evidence base does not support the use of SIT, sensory integration therapy, in education and treatment of children with autism spectrum disorders. According to the Professional and Ethical Compliance Code for behavior analysts rely on professionally derived knowledge-based treatments when making scientific or professional judgments in humane service provisions, or when engaging in scholarly or professional endeavors. If the science is flimsy, an analyst should avoid presenting the treatment as a fully evidence-based practice.
In its infancy, ABA did not have a heady body of evidence supporting it. Nevertheless, practitioners devoted the time to create a body of evidence so that the treatment could be fully supported. Boxing out new treatment modalities does not serve the client base with ASD. According to the Professional and Ethical Compliance Code for Behavior Analysts 1.03, behavior analysts maintain knowledge of current scientific and professional information in their areas of practice and undertake ongoing efforts to maintain competence in the skills they use by reading appropriate literature, attending conferences and conventions, participating in workshops, obtaining additional coursework, and/or obtaining and maintaining appropriate professional credentials. This should include allowing space for treatments that are gaining new footing amongst those with an extensive evidence base, always with a critical eye and with the well-being of the client in mind.
ABA has one of the largest evidence bases for practices when it comes to ASD. Behavior analysts rely on professionally derived knowledge based on science and pledge in their ethical codes to make scientific or professional judgments based on this proven evidence-based scientific treatment. We owe it to our clients to base treatment on proven scientifically based interventions that have reliably replicated successful interventions through years of research. ABA provides such an effective treatment.
New treatments are emerging that show promising results. Evidence-based practices take time to become evidence-based due to the time needed to research and duplicate results. Other treatments such as RDI and exercise-based therapies are building that base of research and deserve to be considered with a critical eye as viable alternatives to ABA for learners with autism.
We examined both sides of whether or not ABA is considered ethical and presented statements that consider arguments for and against applied behavioral analysis. In the following areas, the fairness of everyday protocols and procedures, practices, real-life experiences, attributions of people, present multiple perspectives on all of the issues, impact, legal and ethical violations, comparisons, and evidence-based measures and treatment interventions. Let us hear the final arguments for why ABA is or is not ethical. Kristen, go ahead with your pro summary.
ABA is ethical for these reasons. We have a lengthy ethical code of compliance all RBTs, BCABAs, and BCBAs must comply to or face corrective actions or loss of credentials. This code also ensures the rights of the individuals receiving treatment and protects them against subversive interventions. We have a lengthy history of human rights violations that have shaped our science and caused us to review what is applied behavior science, as well as how to apply our science to the most beneficial and effective manner in order to improve the lives of our clients. The 7 dimensions of ABA demonstrate the level of scrutiny and ethical process involved in the development of this science. ABA is applied, analytical, technological, conceptually systematic, effective, and displays generality. We use function-based interventions to treat behaviors that are deemed socially significant to change. Furthermore, we look at research in a critical way. Finally, ABA has arguably the largest evidence base as an effective intensive intervention for individuals with ASD.
ABA is unethical for these reasons. We have a long history of human rights violations and documented use of aversives in the form of physical punishment procedures. The science of ABA is constantly evolving, so treatments that are deemed acceptable and not aversive now may be found to be in the future. The goal of ABA is to normalize the autistic child. While all of this is done without the consent of the child, the lack of concern in transforming a child using a powerful behavior intervention without consent is a modern-day ethical breach that speaks to the unfairness of everyday protocols, practices, and procedures of ABA. Autism is not a trait that needs to be removed. The world needs different ways of thinking and to accept diversity. It should not be a go-to for every child that is diagnosed with autism. There are other therapies out there that may be better suited for the child and their needs other than ABA. At one point, the evidence base for ABA was not the most robust, yet over time, it was able to obtain the studies through using the interventions effectively. Alternative methods of intervention should be given the same latitude to gain traction as their evidence base grows.
In order to wrap up this presentation, I have a few questions that I would like answered. What are some competing contingencies that may influence behavior analysts to act unethical in regards to providing treatment?
Sometimes a BCBA may act in unethical ways that might benefit them personally or professionally as a result of hearing of some sort of treatment that they heard about which is not supported by evidence-based practice. If they are being punished by the client's guardians in one direction or another, pushed by the client's guardians in one direction or another, or even having good intentions that result in negative actions or appearances regarding their clients. However, this is an unethical practice for a BCBA, as not only the client, but as well as the friends and family members who depend upon the BCBA to produce the most possible and positive outcomes for their child with autism. A competing contingency could lie within many areas of a BCBA's job, as they are entrusted with the care of clients who are defenseless against them. These errors could lead to possible ethical or legal violations toward the involved therapists, clients, BCBAs, as well as the employing clinic. Potential competing contingencies include not having a focus on practices using ABA or EBP, working for the parent or guardian instead of focusing on the needs of the child, advising a client outside of the scope of a BCBA's practice, such as in the field of medicine, other demands of the BCBA which prevent them providing the best care, such as personal reasons or having a large caseload, lack of appropriate oversight for therapists working with the client, dual or competing relationships with clients, and as well as concerns for client privacy.
What are some ways organizations can promote ethical treatment, and how does this ultimately impact this field?
Organizations can make sure all behavior analysts are well versed in the professional and ethical compliance code for behavior analysts. All behavior analysts should be trained by their organizations to perform skills necessary to provide ABA intervention effectively, competently, ethically, and safely. Employees should be trained to rely on scientific knowledge, fully understand the responsibility to provide ethical, effective behavior change programs to clients and their families. Behavior analysts and the companies that employ them should ensure clients are involved in the planning of behavior change programs and receive full consent for programs that are put into place, as well as provide treatment in the least restrictive environment necessary for effective treatment. When behavior analysts provide effective treatment in an ethical way, we promote and raise up the field of behavior analysis. We are individually and organizationally responsible for raising up our chosen field in order to continue to improve the.
Do you have any personal experiences related to this topic that you would like to share?
I have seen the benefits of ABA when implemented appropriately for children with ASD. I personally have been present when a child spoke their first word as a result of extensive ABA therapy. Watching their verbal repertoire expand from 1 word to 25 words to 2-word sentences, the impact was undeniable. Conversely, I have witnessed the absolute sympathetic nervous system breakdown that resulted from an escape extinction procedure. When an individual is in fight or flight, when their frontal lobe function is all but shut down in anticipation of an attack, learning cannot occur. According to Preston and Eichenbaum, 2013, memory consolidation occurs as interplay of the hippocampus and activity in the prefrontal cortex. It is dubious that these extinction procedures are being formed into long-term memories to understand that the reinforcement was not delivered. While ABA may benefit some, we must be prepared as professionals to admit when this treatment is ineffective and alternate routes must be considered. According to the BACB Professional and Ethical Code 4.03a, Individualized Behavior Change Programs, behavior analysts must tailor behavior change programs to the unique behaviors, environmental variables, assessment results, and goals of the client. This includes admitting when our treatments are ineffective.